Hello and welcome. Today we're discussing a critical neurological event that often serves as a warning sign: the transient ischemic attack, or TIA. Understanding TIAs is vital because recognizing the signs and seeking prompt medical attention can significantly reduce your risk of a more devastating stroke. A TIA, sometimes called a mini-stroke, occurs when blood flow to a part of the brain is temporarily blocked. The most common cause is a blood clot that travels from another part of the body, such as the heart or a large artery in the neck, and gets lodged in a small blood vessel in the brain. Other causes include narrowing of blood vessels in the brain due to atherosclerosis, a condition where plaque builds up inside the arteries. Rarely, a TIA can be caused by a sudden drop in blood pressure or a spasm in a blood vessel. Let's delve into the pathophysiology. When a blood vessel is blocked, the brain cells in that area are deprived of oxygen and glucose, which they need to function. This lack of oxygen, known as ischemia, causes neurological symptoms. However, unlike a stroke, the blockage in a TIA is temporary, and blood flow is restored relatively quickly, usually within minutes or hours. Because the blood flow returns before significant brain cell damage occurs, the symptoms are transient, meaning they resolve completely. But even though the symptoms disappear, the underlying problem that caused the TIA remains and increases the risk of a full-blown stroke. TIAs are surprisingly common. It's estimated that hundreds of thousands of people in the United States experience a TIA each year. The risk of having a TIA increases with age. Other risk factors include high blood pressure, high cholesterol, diabetes, smoking, obesity, heart disease, and a family history of stroke or TIA. It's crucial to remember that while anyone can experience a TIA, certain lifestyle choices and medical conditions significantly increase the likelihood. Recognizing the signs and symptoms of a TIA is crucial for getting timely treatment. The symptoms are similar to those of a stroke, but they are temporary. These can include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, difficulty speaking or understanding speech, sudden vision problems in one or both eyes, sudden dizziness, loss of balance or coordination, and a sudden severe headache with no known cause. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call for help. Even if the symptoms disappear, don't ignore them. Treat it like a medical emergency and seek immediate medical attention. Diagnosing a TIA involves a thorough medical history, a physical and neurological examination, and several diagnostic tests. A doctor will ask about your symptoms, medical history, and risk factors for stroke. The neurological will assess your balance, coordination, reflexes, speech, and imaging tests, such as a CT scan or MRI of the brain, are used to rule out other conditions and to look for any evidence of stroke. Vascular studies, such as a carotid ultrasound or angiography, may be performed to check for narrowing or blockages in the arteries that supply blood to the brain. An electrocardiogram or echocardiogram may be ordered to look for heart problems that could cause blood clots. While TIAs are not technically classified into distinct types, the underlying cause of the TIA can vary, which influences the approach to treatment and prevention. For example, a TIA caused by atrial fibrillation, an irregular heartbeat, will require different management than a TIA caused by carotid artery stenosis, a narrowing of the carotid artery. Therefore, identifying the underlying cause is paramount. The primary goals of TIA treatment and management are to prevent future strokes and address the underlying cause of the TIA. Treatment typically involves medications, lifestyle changes, and, in some cases, surgery. Antiplatelet drugs, such as aspirin or clopidogrel, are commonly prescribed to prevent blood clots from forming. Anticoagulant medications such as warfarin or newer oral anticoagulants may be used if the TIA was caused by a heart condition. Lifestyle changes, such as quitting smoking, eating a healthy diet, exercising regularly, and managing blood pressure, cholesterol, and diabetes, are also essential. In cases of significant carotid artery stenosis, surgery, such as carotid endarterectomy or angioplasty and stenting, may be recommended to open up the narrowed artery. Preventing TIAs involves managing your risk factors for stroke. This includes controlling high blood pressure, high cholesterol, and diabetes, quitting smoking, maintaining a healthy weight, eating a healthy diet low in saturated and trans fats, cholesterol, and sodium, and exercising regularly. If you have a heart condition, such as atrial fibrillation, work with your doctor to manage it appropriately. Regular check-ups and screening tests can also help identify and manage risk factors before they lead to a TIA or stroke. The prognosis after a TIA varies depending on the underlying cause, the presence of other health conditions, and the effectiveness of treatment. However, the risk of having a stroke is highest in the days and weeks immediately following a TIA. Therefore, it is crucial to seek prompt medical attention and follow your doctor's recommendations to reduce your risk. Recent research has focused on identifying biomarkers that can predict stroke risk after a TIA and on developing more effective treatments for preventing stroke. Studies are also exploring the use of advanced imaging techniques to better understand the mechanisms underlying TIAs and to identify patients who are at highest risk for stroke. Remember, taking proactive steps to manage your health and seeking immediate medical attention if you experience TIA symptoms can significantly improve your long-term outcome.